The alarm point for lung is lung 1, okay? So here's the humerus, right? So we are just on the inside, okay, medial, and we are in the pectoral muscle. So you're about at the height of the shoulder joint, and then you go a little bit below it, okay, in lung 1. It's right here. So what I would be doing when I'm doing my case studies for this class, when I've done my 4 exams and I've checked association points, as I'm checking them, if I found something on bladder 13 or in doing my assessment, I got indicators of maybe an imbalance in the lung system, I would check lung 1 then to see if there's a response. If there is, I'd make a note and say, it might be a little deeper in the body, maybe involving the actual organ. Or I don't get a response, move on. Okay, so I'm not checking all the alarm points, I'm only checking ones that I get an indication that I should. Does that make sense? Mm-hmm. Okay. The association point for large intestine is who?
25.
5 or 25. And how do I find that? Okay, so my floating ribs straight up gets me to 23. My actual bony ilium is here. 2/3 the distance back is 25.
You write that one.
That's a good point. You just scratch that.
Lateral to the 5th lumbar, if you can count numbers. Is that true?
I believe so. I'd have to look to tell you for
yes.
sure.
Yeah.
Okay. I just, some of them correlate.
Right.
25.
And 5.
27.
Or some don't.
Yeah. Well, and the alarm point, speaking of 25, right?
Right.
For large intestine is stomach 25. So the 25-25 thing. So stomach 25 is just lateral to the umbilicus. Now this is always the fun part of trying to find umbilicus or umbilici, however you say the plural, on dogs. Okay? So I can help you do that, but oftentimes you can, especially on some dogs, you can really find them. I just sort of stroke back and forth. Sometimes it helps to actually look for them. And then you are just lateral to it, and you are too soon, okay, off the umbilicus is where your alarm point is. So same thing, if I found something on my association point, bladder 25, I would then check the alarm point at that time. Okay? Are you giving her your good side? Okay, Pixie. Hey, can you sit? Preferably not with your back to everybody. Sit down. Can you sit? Can you lie down? Can you go on your side? Oh, good. All right, so let's do the lung meridian. Okay, so here's her humerus. We're coming in. We're in the pectoral muscle is lung 1. Alarm points you want to tread lightly. If they're sensitive, you don't want to just go jabbing in there. So, I'm using a finger like this to illustrate, but I'm really not pressing very hard. And to find it, I'm stroking through the area, okay? Then it goes up, and it's coming down the medial side of the arm, okay? Coming around into the nail bed at the dew claw, okay?
Or if she's laying down, it's going down. But you're saying it's going up because it's a...
Because I was going up the leg, but you're right.
Okay.
Yes. Okay. So I'll show you on this one. So here we are. Lung 1, go up a little bit. So you do go up before you go down. Okay. Because 2 is a little higher. Then you round the curve and you're coming down the inside. And this is the highest up. There's going to be 3 meridians here. Once you learn them all, you have a really good sense of where they are. This is lung. This is pericardium. Okay. And then this is heart. You're fine.
So the one that's on the highest surface there, when they're sideways, is
lung.
Lung.
Okay, so I've got lung. Here's 7 at the styloid process, 9, and then I come down. You're fine. To the dew claw, lung 11. Large intestine starts. I'm going to start on one leg and I'm going to miraculously jump to the other one, so don't get distracted. Okay, so it starts the nail bed comes up to 4. Well, let's see how she does. I think she's okay. So we start here. I just won't press this hard. You're fine. You're going home in a little bit. Yeah. What's this like? She was just a playgroup. She should be settled down. Okay, so we start here. We come up to 4, which is underneath the dew claw or at the scar. Comes up a little bit higher, and then it crosses the carpus. So it's going to cross, and then we get to 6. Okay? We're staying the highest up on the leg, just like we did with lung on the inside. We're coming up to 11, which technically you're going to crease the elbow, just like we did on us. We are coming along the cranial aspect of the humerus. Okay? Up to a point, cranial to the acromion. This is large intestine 15. Then I'm coming up the neck, and I'm aiming for coming along her lower jaw. Most texts have it cross at their canine tooth up to large intestine 20. Okay, so you come along like this, and then you go up like that.
You cross sides with ends?
Yeah, when you're tracing for me, you can just stop on the side you're on, but I do want y'all to know that technically it crosses and ends on the other side.
Because on this one, they have it up above there.
Yeah.
Yeah.
Okay.